already have. It does seem that when they look at studies that people who aren't doing the exercise seem to lose the bone density a little more rapidly than someone who is doing the exercise. So it definitely won't hurt. Your exercise program should be site-specific. So just as I spoke about a walking program, and that's going to improve your walking, with your bone health, if you're walking, that's not going to improve the bone health in your arm because you're not putting any weight through your arm. So that's going to help with the bone density in your legs. So it needs to be site-specific. You need to work on the areas where you need improvement. Additionally, if you are diagnosed with osteoporosis, you don't want to be doing any high-impact activities such as jumping, probably running. Things like that could put you at risk for fracture if you already have decreased bone density. So you'd want to stick to things more like walking, brisk walking, activities in the pool, even just resisted exercises, sitting or standing in your home. Balance training, I kind of touched briefly upon earlier, with strengthening. But it's also very important if you're diagnosed with osteoporosis because you always hear the horror stories of someone falling and breaking a hip because their bone density was low. Well, let's prevent the fall, and then hopefully you won't have to worry about the fracture. So when you're working on an exercise regimen, doing the aerobic activity, the resistance training, you're working on your balance anyways because you're having to hold yourself up to do all those activities. So balance training is definitely a key part for someone who's diagnosed with osteoporosis. All right, what to do to begin an exercise program? Probably about half of you raised your hands saying you had an exercise program. So the other half of you, here's what you need to do. Definitely talk to your doctor. That's where the education process begins. You may have some other comorbidities, past medical history that needs to be discussed before you begin that exercise program. Couple areas, if you have any heart problems or you have diabetes, you may need to change some things in relation to your exercise to make sure you're not putting yourself more at risk by exercising. Once your doctor clears you and gives you kind of all the information you need to begin your exercise program, you need to continue the education process, which you kind of actually have begun today. A great person for that is your physical therapist, maybe a trainer at the gym. But they can educate you on all the different types of exercises there are. I know some of you are still sitting there thinking, again, this doesn't pertain to me, I can't exercise. There are so many different ways to exercise. If you like to do it in a group, if you want to do it by yourself in your home, it's all beneficial. It's all been proven to be beneficial. You just need to be educated to make sure you're doing the activity correctly. I mean, even dancing, that's exercise. So, you know, if you like to do gardening and different things, there's ways you can incorporate that and have that be your exercise. So seek education. What are some of the limitations? When I talk about the studies and what seems to work for the people in the studies, that doesn't necessarily mean it's going to work for you, unfortunately. Those are a limited number of people they're looking at, so everyone's going to be a little bit different. But that kind of can give us a basis on what to try with our patients. Depends on where you are in the with your arthritis. Some of you may be sitting here and you may have your joint replacement scheduled for next week. In terms of that, I definitely still recommend exercising because the stronger you are prior to any surgical or any surgery, then the better off your outcomes will be. But you may be a little more limited in what activities you want to do for exercise. I already spoke about different past medical histories that may limit your exercise. If you have COPD, you may not be able to walk as far as the person sitting next to you, but there are ways to work around that, and you can start to build up your endurance. And finally, and one of the other important things is exercise is not a quick fix. So please don't go home and try a few of these exercises and think tomorrow, oh, you're just going to be back to normal and be able to walk all the way around downtown, because it won't happen. It does take a long time, unfortunately, to see the benefits, but you will see them, so you need to stick with it. If you start an exercise program and you start to see those benefits and you're feeling better and you have more energy and you're stronger, and then you decide, okay, I'm done with my exercise program now, I'm where I need to be, well, then you're just going to slowly decline back. So it's something you also need to keep up for the rest of your life. All right, let's try a few things. I know you can't really do the hamstring stretch here. You can try it if you're sitting in the front row, but that was just to remind you that stretching is very important. And if you don't feel comfortable doing any of these, please don't. Ankle dorsiflexion. This is something we use upstairs after surgery, and if you've had any other surgeries, it's probably been recommended that you do this. It's just moving your toes up and down like you're tapping your toes to the music. So everyone can go ahead and try 5 of those right now. You can do this in standing or in sitting. So lots of these exercises, there's many different positions you can do them in. So if you're not comfortable laying flat, or if you're not comfortable standing because you feel like your balance is off, that's why it's important to seek the education, because your therapist or your doctor can give you alternative ways to do some of these. Hip flexion. So this is going to work the musculature around your hip. So if you suffer from arthritis in your hip, also it'll help to hold you up against gravity. You can go ahead and try those now in sitting. Just raising your knee up and then back down. Nice and slow. You want to be controlling the motion using your muscles, and don't let gravity just pull your leg right back down. We do this one after surgery and standing, like the second picture there shows, holding onto a bar. All of our patients get to experience that the day after surgery. People are nodding. Knee extension. This is working the muscle in the front of your thigh, and this is one of the ones that's important if you do have arthritis in your knee, because it'll help to, the quad, the muscle you're working, can help to take some of the pressure off the joint. This muscle is also important when you go to stand. It's one of the main muscles that helps you to stand, also a main muscle when you walk. So it's a great one to work to have benefits all around. All right, sit to stand. Everyone, I'm sure, wants to stand up. So why don't you try this one? You can stay standing because we'll go on to a standing one. But this exercise is one that you can do 5, 10 times in a row, just like the walking and practicing what you need to get better at. If you're someone that has problems getting up from low surfaces, start practicing this by pushing up, and then as you get stronger, you can do it with just one hand, and then try it without using your arms at all. And as you get stronger and you keep working on this day in and day out, those muscles in your hips and your knees that you use to do this motion will get easier. I see some people doing mini squats. Same thing. Hip extension, another one that we do after therapy. The first picture is someone laying down. You don't have to do that. But the second one is someone bringing their legs straight back behind them. That's going to work the muscles in the back of your hips. You want to keep your knees straight. Please don't fall. If you don't feel comfortable, don't do it. And then finally, one where you can bring your leg out to the side. This again works the muscles in your hip on the leg that you're bringing out to the side, but then it's going to work on your balance because you're having to balance on one leg. So back to kind of preventing falls and working on muscles that hold you up against gravity to improve your posture. All right, that's it.